Sara Bostock.
And what's your involvement, Sarah?
I lost a 25-year-old daughter to a Seroxat-induced suicide 2 weeks after she started taking Seroxat for anxiety and racing thoughts. And her personality and demeanor just completely changed in that 2 weeks. She just became very agitated and had kind of a look, in the last couple of days, she had like a look of terror on her face. It was just awful. And
But I mean, is this an age-related? Tell me, is it related to young daughter? Tell me about that.
I don't believe it's age-related at all, actually. I believe it's happening at all ages. I do think that it's that there is some predisposition, perhaps, to react to antidepressants adversely. You know, some people react more than others. I believe that. And but also Seroxat creates a chemical dependency more rapidly than any of the other antidepressants because it has a very short half-life. And it's extremely hard to get off of it, actually. And one of the things that's been happening is that people who have been on it for a long time mistake their dependency on it for for their actual illness, and it's not really and if they attempt to come off, they will have quite severe symptoms and they may have to do it extremely slowly, or they may have to, like, over a period of months, if not years even. It's much longer than most medical professionals will tell you. They don't even realize how difficult it is to come off, actually, or what's involved.
So there are two systems, you could say. Obviously, you've got the FDA. Is the education better in the States in terms of how to come off such drugs with adverse reactions and etc.? Tell me about that. What can the States teach England and vice versa?
Actually, I don't think the States is better than in withdrawal. In fact, we have David Healy has one of the best protocols for coming off of antidepressants, actually. And then we have there's at least one psychiatrist in the States, Joseph Glenmullen, who is also very knowledgeable on withdrawal. But in general, medical professionals in both countries are, really in denial about what some of these issues are, frankly, which is really sad. And in fact, there was a lot of discussion of the polypharmacy in the panel just now, and one of the things that happens is that when you get the side effects from the antidepressants, which often can drive someone into mania or even psychosis, the doctors and professionals, instead of trying to remove the drug, they don't recognize it as the causative agent, and they put you on it like a mood stabilizer. And then they might put you on a sleeping agent or tranquilizer. It just gets more and more complicated, and they're actually medicating side effects of the previous things. And then you get into a lot of trouble trying to get off of a cocktail, because that's really hard.
And how deep-rooted is this lack of education in terms of GPs, as we call them, doctors, throughout the nursing sort of aspect? It's just how scary is it in terms of the lack of education?
Well, personally, the whole system is so invested now in this way of doing things that it's very, very difficult to change. And also, culturally and socially, patients are demanding this, demanding pills because they don't want to make the changes. They don't believe that they can do it themselves, really, is part of the problem. But, in addition, they don't want to go to the trouble of making lifestyle changes or whatever it is. Because even a seriously disturbed person who has been traumatized in some way, can become a lot better or can learn to manage or whatever. They don't necessarily have to be on a cocktail of drugs to control the stress or that they feel. In fact, one of the issues that I have been interested in actually is the Iraqi veterans coming back. and they are all getting diagnosed with post-traumatic stress syndrome, and they are being put on cocktails of drugs, and then some of them are being sent back to the front for a second or third time on antidepressants, and it is frightening, because you can lose your judgment, and you're emotionally blunted, and it's to be in the fire on the front when you're in that condition is just crazy, really. But let's see. Wait, say the question again. I mean, I had another thought.
It was sort of how deep-rooted is the lack of education on the concept of training professionals to appreciate and be aware of adverse reactions to certain drugs.
It's really difficult, because the medical professionals and, of course, the pharmaceutical industry are resisting this information coming out, really, because if people knew in advance how difficult it was to get off drugs, they might not go on them so readily, and that would hurt the bottom line. Unfortunately, this whole thing is so commercially driven, and the only reform is really coming from victims and survivors. It's like David Healy said, this is being put on by a mother who lost a child, and the same thing is true in the States. I write a lot of letters to journalists, and I also am fairly active on a number of blogs, and I've actually influenced some journalists, to become more aware of these issues, and they're writing things. But it's just, you're beating your head against the wall. It's really sad. And I think, I know what I was going to say. Basically, I think this whole thing is going to bankrupt the healthcare systems in both America and here. And I don't mean just psychiatric drugs, but the whole issue of overtreatment is so deep-seated now in all these countries, and the concept of selling sickness instead of promoting wellness is, and it's really gonna damage our healthcare, which is really sad. It's one of the things that's crippling the costs of our systems now.